Good afternoon, everyone. My name is Representative Jamila Taylor from the 30th District, which is centered here in the city of Federal Way and includes parts of Des Moines, parts of Auburn, unincorporated King County, Pacific, and Algona. Thank you for joining us for this press conference today, and I definitely want to welcome you into this space, which is Wayside United Church of Christ, and I'd like to welcome Amy Johnson.
Good afternoon, everyone, and welcome to Wayside United Church of Christ, where no matter who you are or where you are on life's journey, you are welcome here. My name is Reverend Amy Johnson, and I am just one of many faith leaders here today. I'm a longtime member of this particular local church, Wayside, and I also serve in the national setting of the United Church of Christ as Minister for Sexuality, Education, and Justice. The United Church of Christ has a long history, over 5 decades, in fact, of supporting reproductive rights, health, and justice, as well as affirming and supporting our LGBTQ siblings through General Synod resolutions and actions and initiatives. This local church joins that history. We have been an open and affirming church since 1991, not only opening our doors to LGBTQ siblings in Christ, but affirming all genders and people of all orientations as children of God, created in God's image. We welcome you here today, and we welcome the opportunity to support justice and access to health care in our state. Thank you. And I'd like to introduce Senator Claire Wilson, who is the senator for the 30th Legislative District.
Thank you so much. It's an honor to be here today and an honor to have you all here in the 30th Legislative District. And it's also my honor today to introduce to you the Governor of the state of Washington, Governor Jay Inslee.
Thank you. Thanks for joining us in this beautiful church. We appreciate opening this church to us. Oh, I have something simple to say. Washington State was a pro-choice state. Washington State is a pro-choice state. And we are going to do everything humanly possible to make sure that Washington State is always a pro-choice state. That's what we intend to do. This is a health care issue. Access to a woman's right of choice is a health care issue. And health care needs to remain the providence of individual Washingtonian women. That is a right. We intend to protect that right. Today we will talk about multiple ways to do that. One, we'll have a discussion about a shield law to shield people in Washington to get access when they come from other states. Those are our sisters as well. Those are our nieces and our cousins and our children and our grandchildren, and they deserve protection. So these laws will prohibit other states of these anti-choice, dictatorial politicians who want to control a woman's right of choice in our state. We will keep their tentacles out of the state of Washington. Yes. You will hear a very necessary bill we will reintroduce this year that will make sure that we have actual access to abortion services so that hospital mergers do not deny women the actual ability to get these services. And importantly, we will introduce a constitutional amendment to enshrine in our basic foundational document the right of women's choice in the state of Washington. Women deserve this in the state of Washington. And I want to address the necessity of a constitutional amendment and the necessity of these laws for a moment. We have to represent a disturbing reality in that there is an ongoing attack in this state on a woman's right of choice. It is going on every day in the state of Washington. Legislators who are not in my party have introduced 40 bills to restrict or eliminate the right of choice in the last several years. Many candidates are running on that election cycle this year. They try to pull this camouflage over themselves sometimes, but we have to understand that this attack is ongoing against the pro-choice rights of women in the state of Washington. And because it is ongoing, because it is a daily attack, Every single day we have to protect this right. And I'm proud to stand with this community to protect the right of choice in this state. Thank you.
Thank you, Governor Inslee. And we'll bring up Representative Drew Hansen, who is the chair of the Civil Rights and Judiciary Committee.
Thank you. All right, how y'all doing? All right. I'm just going to break stuff. Thank you. I'm Drew Hansen. I chair the Civil Rights and Judiciary Committee in the House. When the Supreme Court leaked the draft opinion overturning Roe versus Wade, we started right away looking at all the different ways that we could make sure reproductive rights in Washington state are safe. And we knew that other states were being creative and aggressive even before that draft in trying to limit reproductive rights. So Texas famously passed SB 8, which allows anyone in Texas to sue anyone who assists someone in Texas getting an abortion. We could see, as indeed happened, that other states would try to criminalize abortion once Roe is gone. Well, if other states are going to be creative and aggressive in enforcing their anti-choice laws, we will be creative and aggressive in fighting back. That's what my bill does. The governor referred to it kind of in brief as the SHIELD bill. This will prevent other states from using Washington state courts or Washington state judicial process to enforce their anti-choice laws. We're going to do this in three ways. There's civil procedure, criminal procedure, and remedies. In civil procedure, we take the ordinary ways you get information in a civil case, like a subpoena. We make it unavailable if you're seeking a subpoena to further a civil lawsuit against someone from outside of Washington who seeks an abortion in Washington. Same thing with criminal law. Normally, you commit a crime in Texas, you can get a warrant against someone in Washington, they can get extradited. Not here. We're going to block those avenues in Washington state. Finally, we're going to make sure this law is enforceable. We will create remedies in civil causes of action against people who try to use the laws in these other states to harass people getting reproductive health care services in Washington state. And look, obviously, this protects providers in Washington state. We have been in close touch with doctors, nurses, and others from being harassed. It also protects people in other states as well. If you are someone in Dallas, you help somebody get an abortion, they travel to Washington state, well, someone might be able to sue you under SB 8. Well, what happens if they can't get the evidence that they need to prosecute that lawsuit because of our bill? Okay, it has just become a lot harder for them to use that anti-choice law to harass somebody in Texas. So we can't do everything to protect people in Texas or elsewhere, but we're using the absolute limits of our authority to protect reproductive rights as far as we can across the country. So thank you very much. Yeah, hooray, hooray. Look. So we have, as you can tell, we have a huge team working on this. Representative Ty, Representative Macri, my colleague Representative Simmons in the House, a bunch of people in the Senate as well. We are looking at a bunch of different ways to go at this, and we are excited and we are resolute. And let me tell you, we are going to use every tool at our disposal to protect reproductive rights in Washington state. So thank you very much for coming here. We really appreciate your time. Here we are.
To say that we are fired up is an understatement. I'd like to introduce Representative Simmons, who is the Vice Chair of the Civil Rights and Judiciary Committee.
Thank you all for coming, and thank you, Rep. Taylor and Senator Wilson, for hosting us here in your district. My name is Representative Tara Simmons of the 23rd Legislative District, and I am the sponsor of the Keep Our Care Act. I introduced that bill last session and unfortunately didn't pass, and so today I want to share with you more about that, because the right to abortion is and will continue to be a fiercely protected right here in Washington state. But is a right really a right if we don't don't have access. The fact is, many of our hospitals and healthcare systems do restrict healthcare, including abortion care. Healthcare consolidations are prolific across Washington state and have dramatically reduced access to our reproductive health care. That's why we must pass the Keep Our Care Act to protect our right and access to healthcare in Washington state. As a former registered nurse, I am deeply concerned about health system consolidations. Healthcare professionals are dedicated to providing the best standards of care for our patients. Yet, rapid health system consolidations impact the quality of care patients get, the affordability of care, and prevent healthcare workers from being able to do their jobs to their full ability to deliver the care patients deserve. I stand with hundreds of thousands of patients, advocates, nurses, and other healthcare workers calling on us to pass the Keep Our Care Act. My community in Kitsap County is really an unfortunate case study in why we need the Keep Our Care Act. In 2013, the only full-service hospital in Kitsap County was acquired by a large health system that has since gone on to gobble up independent clinics across the peninsula. The result has been a multi-billion-dollar corporation controlling healthcare in our county, but having little insight or connection to our residents. The care has become less safe and more expensive, with long waits and fewer choices, including restrictions to abortion care. And it's not just reproductive health care that's at stake. Last year's hearing on the Keep Our Care Act clearly showed the real harms that people are experiencing. One doctor working in Kitsap County testified to a patient who was terminally ill and wanted to exercise his right to medical aid in dying care. The patient knew about the health system's post-merger restrictions on end-of-life care, and so delayed asking for help in accessing the needed medication. When the patient eventually did ask for assistance, the patient's doctor couldn't help because of the health system's restrictions. So the doctor referred the patient out. But by then it was already too late, and the patient ended up taking drastic steps to end his own life. Another incident happened in my community. One Bremerton resident and health system employee testified to needing gender-affirming care for her child. She explained that after the merger, the health system she worked for did not include insurance coverage for gender-affirming care. The family was forced to take out a loan in order to afford their child's health care. Across Washington state, from Kitsap to Bellingham, Vancouver to Spokane, restrictions to care proliferate at a time when people from all over the country are coming to Washington state to seek access to care. Reduced access to care especially impacts rural communities, Medicaid patients, LGBTQ+, and people of color. We can and must do better. Last year, we heard opposition to the Keep Our Care Act from hospital industry because they say consolidations are needed for financial reasons. Yet two of these quote-unquote nonprofit corporations had more than $30 billion in combined reserves and continue to receive taxpayer money. We must put patients over profits and pass the best in the nation Keep Our Care Act. And I'm looking forward to working with my colleagues in this coming session to make it happen. Thank you.
Thank you so much, Rep. Simmons and Rep. Hansen, and just appreciate it and looking forward to working with you both on this. Next, I have the absolute honor and pleasure of introducing a mentor of mine and someone who has been a staunch advocate for gender-affirming care and for reproductive rights for all, and that would be Senator Kaiser from the 33rd Legislative District.
Thank you all. I'm next door, just north of here in the 33rd District. My name is Senator Karen Kaiser. I'm chair of the Senate Labor, Commerce, and Tribal Affairs Committee, former chair of the Healthcare Committee. I'm going to have a bill next year that's a little different. It's going to
protect and indemnify companies and corporations that are headquartered in our state but have employees in states where there are abortion restrictions, to make sure that those employees get the abortion services their company is willing to provide, travel benefits, sick pay, and any other services they need to get the reproductive care that they choose and need. This approach will stop governors such as those in Texas and Florida and Mississippi from trying to levy taxes or other various retaliatory actions against our companies that are headquartered in our state, and understand that reproductive choice and freedom is a human right. Thank you.
Thanks so much. I would like to next introduce Mercedes Sanchez, who is from the Cedar River Clinics, which is run by the Feminist Women's Health Center, a social justice organization that combines direct services with advocacy and activism and community education, ensuring access to reproductive and sexual health care. Mercedes Sanchez.
Thank you. I'm Mercedes Sanchez, the Director of Communications with Cedar River Clinics. As a first and second trimester abortion provider, Cedar River Clinics have been serving patients from out of state for decades due to existing restrictive laws. Throughout those same decades of service, anti-abortion politicians have chipped away at our rights, policy by policy, law by law, and now they've had the Supreme Court victory they have long hoped for. Since the SCOTUS decision to overturn Roe v. Wade and the subsequent state abortion bans that have and will continue to go into effect, there has been an intense escalation in anti-abortion efforts and ongoing attacks on our rights, including access to contraceptives and gender-affirming care. Everything has intensified for Cedar River Clinics and other abortion providers in our state, including and most importantly, our resolve and commitment to provide and protect abortion care for Washingtonians and those that need to seek refuge from oppressive state laws. I would like to highlight that not everyone is pregnant at the same time state bans go into effect. This is a national health crisis, and it will be a rising tide of patients for years and years to come. We need to prepare by creating systems of sustained support and funding for clinics and abortion funds, and by implementing legislation that strongly and directly opposes these oppressive laws. Clinics in Washington are seeing more and more people traveling to us from across the country. We have been receiving phone calls from both potential patients and people who are not even pregnant yet. They are anxious, angry, and scared about losing their rights. They are voicing the real fear of legal reprisals from their home states and the possibility of legal actions by partners and family who want to control or punish them for their personal health care decisions. It is clear that anti-abortion groups and politicians are weaponizing our legal system to attack abortion providers and further intimidate and control their own state residents from seeking health care anywhere. Cedar River Clinics will not back down from these attacks, and we will continue to provide care as we have been since 1979. Cedar River Clinics and other abortion providers in Washington state continue to stand strong in the face of opposition, due in part to the tremendous support we have from state leaders and our fellow advocates. Bodily autonomy is a human right, one that we here in Washington are prepared to fight for and protect. We are grateful to Governor Inslee and our pro-abortion legislators everyone standing behind us, our fellow abortion providers and reproductive health care advocates. We are grateful for them standing up for what is right and for protecting providers and patients from unjust laws and legal actions. We are all dedicated to making Washington State a safe place that defends abortion providers and welcomes abortion seekers with open doors and open arms. Thank you.
I want to thank everyone for their words today, and I want to thank so much the folks that are standing behind me, the representatives, the legislators, the faith-based community. This is a piece of work, and we all have work to do. Someone who's worked in community for over 40 years and worked with children, with families, with pregnant and parenting teens that are 11 to 21-year-old. This is incredibly important, and we need to continue to stand firm and stand strong to protect the rights of individuals across our state. With that, I'd like to open it up for any kind of questions the media might have, and individuals that spoke are open to answer questions. Is there anyone that might have something they want to know more about? I'm a teacher, so I can give you 3001, 3002, 3003. If not, looks like we are good. And I will say, just absolutely honored to be here today and honored to have you choose the 30th Legislative District as a place to be and to collect and to talk about how important this issue is and how we'll continue to fight for the rights of all individuals across the state of Washington. Thanks so much for being here. Thank you.